If you could save people's lives, would you do it? Doctors, nurses, surgeons, you get to choose. There's only one problem. You can only choose one. Will I make the right decision and save all of Minecraft? Or will I fail and be laughed out the door? Stick around to find out. Hi, I am an RN. So I thought first comes love, then comes marriage. You know, like first you're a nurse and then you're a doctor. You know, that's how it goes, right? I don't know. All I know is I've decided today that I'm gonna be a doctor. I was trained in Minecraft once. Now I can officially help all of these old people. Well, if it isn't Brianna. Nicole, I remember you. She kicked me from the nurse server. Sorry, Bri, this server is for doctors only. I'm afraid we're going to have to remove you. Really, Nicole? Really? I'm beginning to think Nicole has something personal against me. Bri, I played as a doctor before and received my certificate. Even with all of that experience, this server is only for doctors. Guys, I trained as a doctor. Didn't you see it? Furthermore, we don't need your help. I'm going to have to ask you to leave. I don't know. I felt like Nicole would point at me. She didn't, but I felt that energy. How can Nicole expect me to leave when Gerald, Margaret, and Harold are all in the waiting room? I love old people. I can save the old people. I've had enough. I've had enough, Nicole. Let me help people. Security. Oh no. I am not prepared for it. Who is this? No, sir. I don't know who you are. Please get away. Don't punch me. We don't need your help. This server is for doctors only. I literally got a certification, certified as a doctor. I know what I'm gonna do to prove them wrong. Look at me. I'm beautiful. Now, I do feel like this looks a little more like a nursing outfit, you know, my natural territory. However, we're gonna see if this tricks Nicole. Nicole, I'm coming for you. I just want to save Harold. He's been in the waiting room for 23 hours. Look, I don't even know what he's looking at. Let's see if I can give Miss Nicole a run for her money. I'm ready for my shift now, Nicole. What are you looking at? I'm right here. Oh, wow. You weren't kidding. You really did become a doctor. So all it took to convince you is an outfit? I don't trust this lady. Well, if you really did pass medical school, we actually need all the help we can get. That's what I've been saying. You'll need to go back behind me to the equipment room to suit up. I'm ready to suit up. You will need a full hazmat suit for treating the infectious patients. I have to put on my PPE. How about you guys go ahead and leave a like on this video so I can save all the patients. Ooh, a security guard's in here. I've got my eye on you. Oh, sir, get away. I need to wash my hands. I'm offended. Excuse me. Make way for Bree. She's washing her hands today. Let's see what else there is to check out back here. There's 2 levers. Oh my goodness. Not only did my hair color look like it changed, I am wearing a full-fledged hazmat suit. But you can't be too careful. Now that I'm in this, I definitely need to disinfect. That felt nice. I feel all disinfected. I'm clean and ready to report for duty. I just wanted to say that. You look like you're all geared up. Here is your ID card. This will get you into the senior staff room upstairs. Look for an iron door and just swipe your ID card to get in. I hope the senior area is for old people. I love them. I'm super fast in my super suit. Name the movie in the comments. This looks like it's it. I'm gonna swipe skadoodle. That was so satisfying. I feel like I'm officially a doctor only because I swiped a card. It just felt good. So now that I'm official enough to get into the senior staff area, I have received a stethoscope and a new doctor. Oh, a patient list. Flu, strep, pneumonia, meningitis. Guys, my mom actually almost died of meningitis in real life. That stuff is no joke. I'm going to begin my rounds for my patients today. It looks like I have this wing of the hospital, and to start doing that, I am going to grab, holy cow, this storage unit has tons of stuff. I'm gonna start with just a lovely syringe. We're gonna put 4 of those in my inventory. Hello, Mr. Troy. I'm really sorry about this, but I have to draw your blood this morning. Woo! He jumped. He literally jumped. I'm so sorry, but we just have to test your blood to make sure your results are okay. Mr. Hunter, don't look at me. Just listen to your anime music as I... Guys, I should have labeled these. I'm just saying. Mr. Isaac, You look real snazzy. I'm gonna distract you and tell you that I accidentally set my bed spawn to Isaac's bed. That was on accident. Ooh, you have a beautiful beard, Jonathan. I definitely think I have a soft touch, even when I'm having to use needles to help people. Now that I have all these samples collected, I need to look at these samples under a microscope. Sample number 1. Results, influenza. Well, it did say that on the door, but I was hoping he was cured by now. Second, results, healthy diagnosis. That's a blessing. Third, healthy diagnosis. So far 2 out of 3. That's pretty good. And last but not least, pneumonia. Dagnabbit, I thought I was gonna have all healthy patients in the hospital. That doesn't make sense at all. Well, it looks like based on these results, I'm going to give 3 of the patients just some pills, some antibiotics, just some fever reducer to the guy with the flu, and some vitamins to the other 2. Also, they're colorful, so that means, of course, they taste good. Oh, I look terrifying, but sir, here are your yummy pills. He liked them. See, what did I say? They tasted good. Hunter, here is your medicine. Sir, they're flavored. See, everyone is loving their flavors. Oh no, wait, why is a nurse in there? Why is a doctor having to run in there? We're going to need a crash cart in here? Oh my goodness. Dr. Brianna, I'm going to need you to get a defibrillator from the storage closet, stat. Oh, guys, we cannot mess around with this. I am sprinting to the storage closet. Every minute is muscle, they say. Get a defibrillator. It's used to restart the heart with electrical pulses. And Isaac, I will save you. Excuse me. Thank you, doctor. We've stabilized him for now. He's still critical. Clean up and meet us in the operating room ASAP. Oh no, I wonder if he has an aneurysm. We would have to stop the bleeding. Hurry, we have to sprint to the operating room. Oh, Harold's still in the waiting room. That's so sad. Still watching you. Dude, I'm trying to save patients today, and you are being a mess. I'm all clean and I'm ready to go. The surgeons look so official. Isaac is just laying on the table though. This isn't really an OR, is it? I see that you're all cleaned up and ready for operation. Here is the patient's file. You can find the necessary items in the chest behind me. We're ready to operate when you are, doctor. This is really cool, but like not. I'm sorry, Isaac. I hope you get well soon, but this is also kind of cool. He has pneumonia. Clean up the lungs. Pills, saline bottle, and scalpel. Luckily, the lab is pretty well stocked with items. So like I said, here we go. We have pills, a scalpel, and a saline bottle. It cleans surfaces. So I think we must begin the procedure since it is pneumonia by entering the lungs. Well, you guys, it's time to enter the battle zone. How about you go ahead and look under this video, and if your subscription button's red, make it gray because I want to save this patient today. So we are going to use the scalpel in order to clear out all this icky. Oh my goodness, how is he even breathing? Oh man, oh my goodness, there's so much ick. I have to get through to the end. Oh my goodness, this lung is definitely not doing well. I'm doing some business. We're getting it cleared up. Okay, you guys, we have to save Isaac today, so we have to be super speedy and clean out his icky lung. Whew, we have made it to the main part of the lung. Now, any of these magma areas we need to neutralize with saline. Just like that. That was kind of magical. Look. Bloop. Bloop. Now, it looks all clear in here, but what's beyond this wall? Oh my goodness, there's literally a lung parkour. Now this, I definitely did not expect. Oh, well, I think I see the beginning. During this parkour, we're going to have to jump on the magma, like so, jump to the next block, and then neutralize. Ooh, now this one's looking tough, and it's over lava. 3, 2, 1. Woo! 3, 2, 1. Oh, sneaky, sneaky, sneaky. Oh, this is a long jump. Pray for me, guys. Sprint, jump. I don't like the fences. Jump. And a jump. I can't believe I stuck that landing. Bloop. Okay, we're at the top here. Gonna jump-a-rooski. Oh, this is precarious. Jump-a-rooski. Oh, ah! You guys, I think we found the ultimate problem. At the top of this really crazy parkour, there's a ton of infection. Let's go ahead and neutralize all that we can. Oh, this poor guy. Patient stabilized. They will make a full recovery. Yay! That makes me so happy. I mean, he's not looking great yet, but this was some of the finest scalpel work I've ever seen, Dr. Brianna. You've saved this patient. So some people don't realize, but it is a doctor's job to keep everything squeaky clean. So I am going to wear a fancy doctor vacuum, and I'm gonna bring some saline with me because why not? And we need a cleaning sponge. There has been a nasty virus going around in the hospital, so we are going to use this handy dandy vacuum and the sponge in order to clean everything up. And I'll be on my way. So we're looking for any green or red particles that we can find. They might be in nooks and crannies. I don't know exactly where to look. They're gonna be in the little nooks and crannies all around the hospital, so you gotta sneak up on them. See, what did I tell you? We are looking for nasty green viruses and red viruses. So with the green, we're going to use the beautiful vacuum to get rid of those. I'm very glad I can wear this like as a backpack because that would be a lot to lug around a hospital. Now we use the sponge or Rooski on this nasty red stuff. Oh no, there's red viruses in the patient's room. We have to be super careful, you guys. Oh man, this is not looking good, ladies and gentlemen. There are far more red than green viruses for some reason too. You're welcome, Nicole. See, if I hadn't been made a doctor, then none of this would have been done. Whew. I think I finally got the most of it, ladies and gentlemen. Let's see if the lab has any, but other than that, I think we've pretty much cleaned the whole place up. So I'm gonna go back downstairs where I got this vacuum from so I can put it away. It's heavy. As if today has not already been stressful enough, it is time to take care of the critically ill patients. Oh, a nurse. That scared me. These patients are in the critical wing. We're losing hope on them. Maybe you can make a diagnosis, Dr. Brianna. Well, in order to make a diagnosis, let me get out my handy dandy stethoscope and listen. Becca is definitely breathing very, very heavy, and so is Chris. You guys, they need to be put on a respirator stat. I have to hurry and get it. They can't maintain their airway for much longer. Whew, okay, we need, not cleaning supplies. Here it is. We need a respirator and we need two. Whew. Okay, grab these 2 respirators. By the way, they're machines that help people breathe. We're going to bring it upstairs. I'm getting lost in the hospital. We are going to run as fast as we can. Harold is still waiting and I can't get past it. Whew. Okay, you guys, I have the needed supplies. Now I'm just gonna place this here and this here. Wait, what's happening? Doctor, the respirator isn't working for this patient. They're going into cardiac arrest. Oh my gosh, I'm leaving immediately. Their heart will stop if we don't give them a defibrillator ASAP. I'll perform CPR until you return. Hurry. I was already gone before she said anything. Not because I don't want to help. Don't get the wrong idea. You have to hurry and get the defibrillator. Hurry, stat. Oh, luckily she can perform CPR until I'm back here in a moment. Oh, good, you're here with the defibrillator. I don't know how much longer I could have held out. CPR is very tiring, just so you know. Now I just need to use this on Chris. The patient has developed a clot in their lung. You need to bust it out with thrombolytics. There is a syringe in the chest right there. So I've used the defibrillator. His heart is beating, but there is a clot. So a big, thick ball, you can think of it as, of blood, and it can't run through your veins and arteries correctly unless it's liquidy. So in order to dissolve this clot, we use something called heparin. It's thrombolytic therapy for busting clots. So this medicine will break down that clot or thrombocyte. Patient stabilized. Clean up and get to the ER ASAP. Whew, okay. Oh man, that did make me sweaty, so I definitely do need to clean up. Better not try anything funny. Sir, I am literally preparing for a surgery. Yep, that was some intense decon. I am ready and looking fabulous. I have to hurry to the OR stat. Hope that he's here waiting for me already. Oh, thank goodness. Welcome back, doctor. This patient is very weak. We will need to closely monitor his vitals during this procedure. Here's the patient file. We'll start whenever you make the first incision. Okay, no pressure, you guys, no pressure. Oh, I didn't see that fast enough. His vitals were quick. Oh, they're popping up. 1 second. Normal from what I saw. Yes, we're good. BP is a little low. Repair the heart and bust the clot. Vacuum, scalpel, vein tissue, nerve tissue, defibrillator. Defibrillator, tissue, scalpel, and vacuum. That might hurt when I take it into his heart. So we are here inside Chris's heart. We're monitoring his vital signs, and there is this icky goop. The only way I know to clean this is with the vacuum. This is a big clot, you guys. Oh my goodness. So scary. I hope we're getting to the end of it because this clot is never ending. Oh, I didn't monitor his vital signs just then. Heart rate 71, okay. BP's dropping a little bit. O2 is okay. It's a little below what we would like. 98, now it's back. Heart rate is slowing. Heart rate is 0. Oh my goodness. Oh my goodness. Defibrillate. Ooh. Any place that I see redstone, I have to defibrillate. Yes, that made it better. It shocked his heart back. So you guys remember I have this nerve tissue. I am going to replace the tissue that is missing there and seal it together. This one looks good. I climbed all the way up here to see if I missed anything. His heart is still going. I think I have sealed all of the veins and nerves. No, there is one more. No, it's still sealed. Woo! Patient stabilized. Good work. Thank goodness. Excellent work. Yet again, Dr. Brianna. This patient should make a full recovery. That's a big deal. Those surgeries are no joke. It has been a long day's work, and you know what? It is time to tell Nicole I am done for the day. Congrats on your performance today, Dr. Brianna. We really performed some amazing feats today. Excuse me for a moment, I'm getting a call. Oh no, Nicole, not again. Yes, sir. I'll send her up right away, sir. Oh no, this is bad. This is very bad. It's like the principal's office. Dr. Chuckles would like to see you in his office. Oh, it's on the top floor upstairs. I'm excited to see Dr. Chuckles. I can't believe I didn't say hi to him earlier. So many doctors, they look so professional. Thanks for your hard work today, Dr. Brianna. Chuckles! Oh my gosh, I'm like really excited. I'm not gonna lie. Y'all, I have finally made it onto the server. They didn't have any whitelist information, so I'm not breaking in. I mean, I was invited here. It's definitely time to get down to business. Oh no, hold on. A nurse just ran out of the hospital. That is not normal. Hold on, I have to investigate further. Oh, there are a ton of nurses running around. I remember those days. The ER can definitely make you frantic. Hold on, I wanna see what upstairs looks like. I love their nursing uniforms. I need to help them. I feel obligated. Oh my gosh, her eyes are cool. I'm gonna tell Nicole that I'm here. I would like to help the nurses out. I'm qualified. Excuse me, but this server is for nurses only. Unless you're sick or a nurse, I'm afraid I'll have to kick you. Goodbye. Hey, I am legitimately a nurse. I am so offended. Only nurses allowed here. I was offering help. Look, I have a disguise. I mean, I am a nurse, but I'm disguised as a nurse. That seems counter to what I'm saying. So we are going to go and talk to Nicole and see if I can finally help out. She was a little snooty the first time I met her. Hey there, it's me, Brianna. I'm really a new nurse. Nicole, be nice. Oh, it's you, Brianna. I apologize. Just the outfit, now she knows. We've just been so busy around here, I didn't notice it was you. Of course you're welcome. Do you think you can help us out today? We're pretty slammed. I've been offering to help this whole time, and then all I had to do was change my outfit for her to know it was me. I'm gonna stop by Dr. Chuckles' office on the left. He's gonna give me some patients. Ooh, patient assignments. I'm excited. Let's go find his office. I have finally found Dr. Chuckles' office, and believe me, I'm really out of breath. That took quite a long time, but let's go see what he has to say. Mr. Chuckles, I don't really know how you're actually a qualified physician, but I definitely will listen to you. Brianna, good to see you again. I'm so glad we have your help today. Are you ready to get your first patients? I was born ready. Ugh. That was embarrassing. Brilliant. Let me see, where did I put your patient list? Oh, he's looking in the chest. He doesn't know where it is. That's concerning. It's around here somewhere. Guys, patient assignments are very important. I don't know how he's misplaced them. That's probably why they're so busy. One moment. Oh my goodness, Chuckles. Get it together. Here it is. Okay, I was really nervous. He was never gonna find it, but here we go. I have 5 patients today, but it doesn't tell me anything about their chief complaints. So who is my first patient again? George. He is room 208. So silly me, I need to go back upstairs and find his room. 204, 203, 202. Oh, it must be on this side. 5, 6, 7. Oh, here we go. Here is George. George, I didn't picture you to be so hip. Cough, cough. Uh-oh. He did not cover his mouth. Hi, Nurse Brianna. I was just cough, diagnosed with bronchitis. Ain't nobody got time for that. What kind of medicine should I take? Cough. I'm gonna tell him he should probably take a generic antibiotic called amoxicillin, but I'm just gonna point out, in the real hospital, the doctor has to prescribe it. So I'm just overriding that right now. Chuckles is busy. Now that I've told him what I'm gonna get him, I should probably find some. Let's see what's in this chest. Amoxicillin info, redstone dust, spider eye, sugar, and a brown mushroom. So let's see what this info says. Okay, you guys, so the entire hospital is out of this antibiotic, and so I'm gonna have to craft it. And some of the ingredients are down in the supply room. Good thing I don't know where anything is. I just need a mushroom, a spider eye, which makes me feel very uncomfortable, and sugar. Oh, that made a fermented spider eye. I actually didn't even realize that. But the note said they are out of netherwort, so I have to go find it in the supply room, wherever that is. I'm gonna assume it's downstairs. Guys, they should make this easier to find. I can't find anything, so I just looked through the other door, and this is the supply room. So I found the correct place. Now, there is no supplies in that one. The only problem is I don't know where the amoxicillin would be. Oxygen storage, infused storage. What's this? Netherwort storage? Why is it so complicated looking? Apparently, I have to go down a spooky stairwell. I hope I don't fall. Please don't fall, Bri. Oh, we are like in the nether. So apparently, I literally have to go through a parkour course in order to get netherwort. I see it right there. Oh, okay, let's watch another nurse do it. She's literally not struggling at all. Guys, she's doing perfectly fine. And this looks pretty complicated. Okay, she's gonna bring both of us some netherwort, I'm sure. She saw me here, she saw me waiting. Thank you. That was not very Texan of her. We are very thoughtful, but apparently other nurses here are not. So you know what? That just means I'm gonna have to complete it even better than she did. Guys, there is literally a wall up there to help you fall. Why are they making it so complicated for nurses to get medicine? It's time for a leap of faith. Woo! I'm really shocked I made that, I'm not gonna lie. This is our last jump here, ladies and gentlemen. Yeah! Touchdown! How did they retrieve so much netherwort? I feel like a pig was responsible for this, because if I was a pig, I would sniff some netherwort. I don't know what I'm saying anymore. I have to make it back to my patient's room stat so I can help him have some medicine. Goodbye, James. Goodbye, Nicole. Goodbye, Nath. Goodbye, Nah. Goodbye, Daphne. George, I am coming to save you. First, I must craft. Gonna give him a little bit of a spider eye. Yum. Some netherwort. Also yum. And then redstone dust, which doesn't creep me out as much. A broad spectrum semi-synthetic penicillin used especially for ear and upper respiratory infections. So there you go, ladies and gentlemen. I am going to give George his medicine. Remember to drink lots of fluids and take it on an empty stomach, and come back if it gets worse, George. We don't want you to croak. I'm gonna give him his medicine. Oh, he's dancing. He's feeling better already. Cough, thanks, cough, Nurse Brianna. I should have taught him to cover his mouth while he was coughing, but oh well, bye, George. Who's my next patient? Mr. Smith. That sounds very mysterious. Let's head to room 204. It's time to talk to good old Mr. Smith. Hi, Mr. Smith. You have fabulous hair. Hi, I'm Brianna. I'm gonna be your nurse for the day. Nice to meet you. What? I'm confused. I said I'm gonna be your nurse for the day. What brings you in? Uh-oh, he's dancing. I can't hear you. Something is wrong with my ears. Can you help me? I feel like when people type in caps lock, it's basically like shouting. So he definitely has an ear problem. Let's see what's in the chest over here. An otoscope. So an otoscope is like when you go to the doctor and they stick the little thing in your ear and say, ooh, ah, or, oh, it's an ear examiner. And an iron sword. I might need this. It is time to examine. Oh, clear the ear canal, remove all the slime and cobwebs. Ew, I don't like this at all. At least I have an iron sword. They were correct that I need this. The inside of his ear is a little creepy looking and he needs to clean. There is a spider in his ear. Ah! Die! Die! Don't kill me! I'm trying to kill you! Oh, my technique is not working. Oh no, technique. Oh, die, you varmin. Oh, I killed one. I killed the other one. Remaining 61? Hold on. How many things are in this man's ear? I think it's been a while since he's used a Q-tip. That's all I'm gonna say. I don't know if this is an infection or lack of hygiene at this point. There are literal cobwebs. And more spiders. Yay, my favorite. Guys, I'd be interested in the comments if you told me your worst fear because spiders are definitely up there for me. And in order to help me survive this, I still have 42 more things to find in an ear. Make sure you look under this video, and if that subscription button is red, make it gray right now, because otherwise I may not survive. There are more spiders. There's a spider spawner in this man's ear. Hold on, let's kill these real fast. Oh no. Gerald and Harold, they were definitely some spicy spiders. Okay, the spawner is dead, just like the spiders. And I am getting close to the end of this. Thank goodness. It smells real weird in here. That's all I'm gonna say. Oh my gosh. That genuinely just scared me. That spider is floating in the air. One more, I see it. Cleared the ear canal. Mr. Smith can now hear again. How do you feel now, Mr. Smith? Oh, he's dancing. He's happy. The patients dance when you give them what they want. He can hear again. Yay! Guess I should keep better care of my ears. I think you should clean them occasionally, but I mean, it doesn't cause an infection. Thanks, Nurse Brianna. You're the best. I need more patients like that. He's so nice. So next is Tom. Tom is in room 208 and the nurses keep bumping into me. I am a little offended. Let's see how Tom is doing. Oh, there's two people. Nurse Brianna, we need your help. Yeah, Tom is not looking so good. I'm not gonna lie. How can I help, Mary? My husband was in a terrible accident and he lost a lot of blood. My blood type is A positive and I think he is too. I can't remember. What do we do? Just to throw out there, if somebody had an accident and was losing blood, he would definitely be the first patient on your list because of priority. Here we are. Tom is slowly bleeding out. It's just wonderful. Also, Mary doesn't know their blood types. A physician would have to come sign with them that they had consent for blood. And, yeah. So I'm going to need to type and cross his blood type in order to administer blood products. So type and cross is basically when you take somebody's blood and they're A positive, all of that. We find out what their blood type is and then you cross match it with the other blood that's available to make sure they're compatible before you give it to somebody because they could have a bad reaction. Mary is telling me to hurry. I know, Mary, I know. Empty blood bag. So typically in the hospital, you just do this to the patient and you have a lab with all the blood ready. But today, I'm also going to be testing Mary. She's generously donating her blood to Tom if it's compatible. I'm going to need to transfuse blood. Dr. Chuckles should be in here, but it's fine. So I've told her we are going to get Tom's blood as well. Ooh, that looked uncomfortable. So now that I have both the samples, let's head to the lab. So they have a blood analyzer. So we're gonna check and make sure there's no antibodies or anything like that in the blood. So let's throw it on there. Blood type is A positive. She was right. She did tell me she thought she was. Now let's see what Tom is. Analyzing blood. And he's A positive as well. So this is like when you go to a blood drive and you give your blood, it's so your type can go to somebody else's with the same type. So if you have a rare blood type, I don't know if you know if you do, but if you do, it's really important to do blood drives because they're rare. We need to hurry to Tom's room. This is very important. Where did his room go? I've lost my patient. Here he is. Now that I have the blood that is safe for him to have, we are going to click him with the transfusion. Blood transfusion complete. Successfully conducted a blood transfusion. Thank you so much, Nurse Brianna. I'm glad to know my husband is in your excellent care. Blood transfusions take hours, so that was really quick, and we definitely wouldn't normally let Tom leave immediately after that, but I'm so glad I could help. So who is my next patient on the list? We have Earl in 207. Let's go find Earl. Hi, Earl, you look fancy. Brianna, thank goodness. It's my heart. It's beating so fast. Earl looks like a spy, and he already knew my name, so I'm a little uncomfortable, but how can I help you? So I'm gonna get a stethoscope and listen, which is also called auscultate in the hospital. Also, we need to put him on a cardiac monitor, but I don't know if they have one in here. So I have my stethoscope and an iron pickaxe for some reason. So let's listen to your heart, Earl. Oh no. Clear the blood clots. Remove all the blood clots. So that would mean he's having a heart attack if he has blood clots in his heart. Plaque would mean he's just, maybe one day. But how do I know what a clot looks like in here? Is it this? I'm a little concerned. Oh, we are going into a maze. Let's see if that's one. Oh, clot removed. We are down to 14. Man, he has a lot going on. And I have a lot going on in this maze. I am getting very lost, but it all is for the sake of Earl. Oh, another one. I don't know where I'm going. I don't know where I started. Let's try this side. 12 more. This will soon be over. I mean, in a good way. It'll be over. Like, I'm gonna save him. This will soon be over. I get lost really easily, so I'm very impressed I'm actually finding anything. Oh, I think one's behind me. I missed it. That could have been bad. I only have 3 more. 2 more. Look at me. He has a complicated heart. Yes! I only have 1 more. Here we go. Heart valve is clear, and I have successfully removed all of the clots. Let's see. Earl. Oh, he's turning a different way. He's feeling sassy. He's dancing. What did I tell you? He feels great. Thanks, Nurse Brianna. If you actually had a heart procedure, this is not how somebody would respond. But I'm glad. I'm just going to tell him to take a couple days off, have some bed rest. But yeah, I'm shocked we're not going to monitor him anymore. But he's happy and he's walking around. So that's all that matters. Guys, I only have 1 more patient assignment. Elena or Elena? I'm not sure, but that's a really pretty name. So Elena is in room 103. So here she is. Hi, Elena. I'm going to be your nurse for the day. How can I help you? She is feeling fatigued, lightheaded, shaky, and pale. She does look a little pale. So I saw in her patient history before I walked in that she has diabetes. So I'm going to ask her if she's checked her blood sugar recently. Now that you mention it, I have noticed that. I guess she's noticing that her blood sugar is low. I think you may be hypoglycemic. Let me check your blood sugar. Hypoglycemic means low blood sugar, and hyper means high. So let's see. We have a glucometer. That's what you take the blood with to check sugar. We have a glass bottle, blaze powder, and sugar. So it looks like we are going to be doing what's called a glucagon drip on her if her blood sugar is really low. So checking glucose levels. Ouch. I'm sorry. I know it doesn't feel good to take. She has a level 57 on her blood sugar. So her level is pretty low. I mean, normally I wouldn't give a glucagon drip for this, but today we are going to. Let's get her fixed up. Oh, I need some water for my water bottle. So it's not low enough. I typically would do this extreme of an intervention because this is literally sugar going into her vein, but we're gonna put some water in the water bottle and make a potion in order for her to have this medication. And there you have it, a glucagon drip. It prevents blood glucose levels from dropping to a dangerous point by stimulating the conversion of stored glucagon to glucose in the liver. So I'm gonna give this to her. I'm shocked she wants to stand for an IV, but there you go. Administering glucagon drip, and it is finished. So you would typically wait like 30 minutes to recheck their blood sugar. So I'm gonna recheck it and it's 68. So it's still a little low, so I'm gonna give her a snack. We have orange juice in the fridge, which actually would make her blood sugar really high. But if you ever have low blood sugar, drink some orange juice. Of course, they would put the kitchen by Dr. Chuckles' office. That's actually pretty funny. But let's see if we have orange juice in here. Oh, it's fancy. This is a fancy orange juice. Got a little orange wedge and everything. Here we go. Here's some orange juice to bring up your sugar. Thanks, I needed this. You're a real lifesaver. I try. This is actually called a surgery theater, so you can watch the action live, ladies and gentlemen. Look, the surgeon says scalpel, please. We have Mr. Nelson being surgeried upon. Thanks, doctor. We are ready to begin the operation. Oh, that is a big scalpel. All right, I think we're done here. The scalpel. It's in Mr. Nelson. You guys made a horrible mistake and I'm here to fix it. So where are my scrubs? Hello? And surgeons only. We can't have anyone interfering with operations. I already learned how to be a surgeon in Minecraft, so not really appreciating this. No one believed that I was a trained surgeon. Christina, yes, what do you have to say to me? Hello, are you a new surgeon? Can I see your certificate, please? Are you new? Can I see, like, you have to prove you're a surgeon. I have a certificate from Scalpel University. Look how official it is. It even says BriannaPlayz. Yeah. All right. Welcome to the team. You can start by getting the surgical theater cleaned and ready for operation. You can find all the supplies you need in the storage room. I am a professional and I know what you need to clean. You need some sterilizing wipes, cleaning spray, maybe. I mean, that makes sense. And oh, boots. We gotta. These boots were made for medical and not walking. They're made for cleaning. Welcome to the surgical center where there is literally trash everywhere. Here are some stitches. Here is a scalpel, which I don't know where it's been and I'm disturbed. Here's another scalpel. Why are there so many scalpels? Another scalpel. Who has been in here? I'm concerned. We're gonna get rid of all of them. We're gonna put them in the sink where they belong because they be dirty. But these red dots are evil. They are germs, they are bacteria ready to get you more. So we are going to use sterilizing wipes and wait, I didn't even click. I literally walked over the spot with this wipe. It's magic. Hold on. Hold on. Does it work? I am literally just holding it. I'm a professional. I understand why they gave me this job now. I am the only one with these powers. Don't reject me and my powers. I think these should be done disinfecting. Ignore the fact I didn't put cleaning spray in there. So we're just gonna grab a Rooski the items. We're just gonna be okay with having 3 scalpels. I don't know what's happening anymore, but I'm a little spooked. So we're gonna place these on the surgical counter. I can't be trusted with this job anymore. I've gotta leave. Oh, here, we're just gonna place some splints in there and hopefully people will find it. It is time for my first patient. I sensed him nearby. Ew, that sounded really weird. Ew, I just know that I have a patient. I was told to go to 105 as I was done cleaning, but you can't do surgery without your scrubs and your face mask. Wash your hands, stay safe, guys. We're gonna go to room 105. I look very blocky. I don't know that I like this look on me, but we're gonna go in here. Oh, maybe we're gonna go in here. Mr. Rinker, what's happening? You're laying very strange. Like, why are you that way with your head falling off the bed? I don't know if this is a medical emergency or if he simply can't hear me. So patient file, Mr. Rinker's stable, broke his arm. He should be able to respond. We need scissors, stitches, splint, stethoscope. I'm gonna keep that with me because I don't know if I can remember what I just said. Stethoscope, stitches, scalpel, splints, scissors. Oh no, Mr. Rinker, he is ready. He's ready and prepped. Feel free to begin the operation whenever you're ready. Mwah. Bree, you are here for one reason and one reason only, and I cannot complete my first surgery unless you look under this video, and if your subscription button's red, please make it gray for the sake of Mr. Rinker. I'm going to save you, sir. In the count of 3, 2, 27, 5, 4, 6. Oh, yay! So we're inside his arm. So this is his humeral bone, his humerus, and it's not funny at all. You know, some people call the humerus the funny bone, but it doesn't feel funny when you hit it, does it? We're gonna use a splint to repair the bone. Simple as 3, 2, 5, 6. See? Repaired bones are happening very quickly. Who even needs a license for this stuff? I'm kidding. I'm kidding. I promise. But I'm gonna fall. 3. Repaired bone. I repaired the bone. Yes, I am good at this. I say that and then it's literally not working now, so that's perfect. We're gonna jump here. Do that parkour, Brie. I don't think this was meant to be a parkour, but there we go. It's like a little stair step on your bone, you know, it's just extra pizzazz. He has the funky humerus bone. Yes, he does. Oh, okay. I almost died, but we're good. I don't really think there's supposed to be a space there. Sir, maybe I'll just leave you with a really small break. You know, it's gonna give you some character. I didn't repair this, but it's saying I did. Repaired? Ah! I don't even know where I am. I just started flying so I don't die by falling off this bone. This is not working how I expected it to. Successfully splinted the arm. Oh, I am now just out of there. I kind of think I left a break, but that's fine. Great job on the operation. We're running low on some supplies right now. Could you go out and get them? Yes, I could. Here we are at the medical supply store. I have my medical supply list. The store owner's gone, and I think I can... Yes. Close. No. Oh, hide the evidence. Hide the evidence. I've never been here, to their knowledge. We're gonna go down here. Oh, yay. It's a maze. Probably to avoid having problems like what I'm doing right now by taking supplies. We need 3 sets of scrubs. Now, I don't know if scrubs means masks and boots. Typically, when you say scrubs, it's just the top and the bottom. But, you know, I'm gonna go out on a limb and assume I need everything. My inventory is going to be so full by the end of this. I definitely feel like we need a store clerk somewhere because there are too many chests in so little time. Okay, not bad. We have 2 pairs of scrubs out of the 3. Stitches. We need 3 stitches. 3. We're on a time crunch, girl. Yes. Okay, so we have all the pairs of scrubs that we need. Oh, but we still need pairs of scissors. I have not seen any scissors, guys. Oh, yes, I have. Yes, I have. I've seen so many pairs of scissors. That's all they have at this store, you know? I'm having to encourage myself because this is not going so well. Oh, I opened it from the back. I have all the stitches. I have all the scrubs. Thank you for your encouragement. I'm sure you're just commenting, Bree, go to this case and chest and helping me and scalpel. That's my first scalpel. Oh, so I have 2 more? No, 3 more items that I need. The last and final items, ladies and gentlemen, scissors. But it's not a cheer, and we need to run. We need to run, guys, because there's no checkout person. So I'm literally just taking this stuff. Guys, don't do that ever in real life. Nobody was at the store. I know there's a surgery waiting for me. People have requested me. Hello? Mrs. Kim, what are you doing? I fell and scraped my knee. Luckily, I fell right outside the hospital. Can you help me? Guys, if you fall and scrape your knee, please don't lay in the middle of the road. I don't care if it's by the hospital. That is not safe. Lucky for you, I just got back from the store, so we're gonna get our stitches and our scissors. The stitches will go on first. Oh yeah, applied stitches, there we go. Now we just have to trim them. Trimmed with scissors. Look at me, I'm a professional. Mrs. Kim, there you go, get out of the road. Thanks, Doc. My leg is feeling so much better. Well, that was fast because I just put stitches in your leg. I'm healthy enough to head home. Good, it's time to get out of the road, ladies and gents. There is literally a patient on the operating table. We have to look at his patient file from Chuckles. What does it say? Mr. Tom, stable, but he needs a tonsillectomy. Guys, I had a tonsillectomy once. It hurt, but it made me feel a lot better afterwards. So for this, I'm going to obviously need a stethoscope, scalpel, stitches, and scissors. So let's get to business. We're ready for action. Wait, Nicole, what are you doing here? Nicole, I'm not friends with you. Hey, you can't take out someone's tonsils by yourself. Excuse you? You've got to remove them at the exact same time. Follow me. I could have gotten a head start, Nicole. Fine, I do like teamwork. We are in his mouth. All right, we have to remove these at the same time. Follow after me. I will call out which tool you need to use. We'll be working from left to right. Okay, so I'm gonna go over here safely. We're good. Okay, she's going. She's going. It's far left first, which I would think is this one. Scalpel. Scalpel. Oh, there we go. Scissors. Scalpel. Scissors. This really isn't too bad. Oh, I was doing the wrong one. It was bad. Scalpel. Scalpel. There we go. What's next, please? Is it scalpel? I'm impressed you managed to keep up. Okay, hold on, ma'am. Use your stethoscope and let's get out of here. This one is still here. We're gonna remove it real quick. Okay, Nicole, it is time to leave. Got my handy dandy magical stethoscope. My stethoscope isn't working for some reason. We'll both have to use yours to get out of here. Could you come give me a hand? I can't leave a surgeon inside of someone's mouth. So here we go. Whoa! I underestimated your skills, Brianna. You definitely saved me back there. Miss Lewis, I love your outfit. It is not my merch, but I still like it. Let's see what brought Miss Lewis here today. She's stable. She needs a skin graft. You will need scissors, bandages, and a stethoscope. Oh my goodness, I wonder what happened. All right, if you are ready to begin the operation, I am going to use my handy dandy stethoscope. Okay, now I'm understanding what happened. We gotta get rid of this green. That's not it. So we are going to remove the donor tissue. So when you need a skin graft, you have something called donor tissue that helps fill the part of your skin that is hurt. So we're going to start by placing some of these down. I don't know how many we're gonna need yet. Okay, it is green cover-up time. I have retrieved more donor tissue, so here we are. Now we're just gonna place some bandages and... Ooh, that was a good noise. Excuse me, sir, I'm sorry. She looks good as new. She will make a full recovery. Yeah, she will. I am so tired. It is time for a break. Emergency. Patient is presenting with multiple stomach tumors. What? I was literally just taking a break, but obviously I am trying to save lives today, so coffee can come later. What is exactly going on? Critical stomach tumors. Tools needed: tumor freezer and scalpel. It's go time. Okay, yep, this is looking a little bad. I thought I was having assistance for this, but apparently not. We are going to use the tumor freezer. Ah! No! Why is there a big man in there? Freeze. Whoa! Whoa, 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 whoa. I'm sorry. I didn't really mean to completely obliterate you, but oh well, you were gonna attack me anyway. Sir, freeze. That's kind of satisfying, I'm not gonna lie. Some of these are up really high, and I'm not sure if I can literally reach them. Bloop. Ah! He fell on my head, and that will not be tolerated. What is just what? What is happening? Please let me know in the comments if you've ever seen a baby zombie pigman ride a chicken, because I think I'm being bullied. People know I won't kill a chicken. So what's happening? Okay, no! Tumor's cleared. Tumor's cleared. Thanks for your help at the end. I was in there all on my own, trying to not die. No, for those of you wondering, I have still not received a break or eaten any cake. But it's time for the... Excuse me? Dr. Chuckles, how dare you be sick? No, you're not allowed. You're so cute. You look sad. I'm going to save you. I don't know what's happening. Hold on, let me check. Chuckles detector. Well, he's right there. What's wrong? We have to look. Completely figure it out. You have to look right now. Dr. Chuckles, critical brain surgery. Tools needed: Chuckles, checker, and scalpel. Okay, Dr. Chuckles, I will save you. I love you. Dr. Chuckles' brain, find the issue and fix it? His brain looks beautiful. I don't understand. What's wrong with it? Everything looks great. He has veins, he has arteries, he has a brain. Chuckles has a hole in his brain? A lot of chickens are in here. Is it normal to have chickens in your brain? I mean, he is a chicken. So we're gonna use this Chuckles detector. What does this do? Okay, so apparently there is an infected chicken in Chuckles' brain. So we are going to use the stethoscope to, oh, now we're in the infected chicken's brain and, whoa, hold on. What is this? I'm gonna scalpel, hold on. Sir, I was not prepared for this. What is happening? Get the zombies. I don't know why they're riding chickens. I don't want to kill a chicken. Excuse me, but how many are there? Oh my gosh, oh my gosh, oh my gosh, oh my gosh. Please just die. I would like you to get out of my way. Remove thy hands. Oh, good. It's only killing the zombies, not the chickens. This is what I like to see. 3, 2, 1. Oh, he's looking normal again. Thanks, Brianna. My head is feeling much better already. Aw, I'm so glad. Why do I have 2 patients at one time? Jack and Jill. What happened? Insta bone. Drop this to instantly fill in gaps in bone? That's not a good sign. This is not a good sign for Jack and Jill. Jack, critical skull fracture. Jill, stable slipped disc. Tools needed: scalpel, scissors, stitches, and disc adjuster. We are going to get started here. Jill, we're ready for surgery, but Nicole, what? Goodness. Hey, make sure you hurry up with those surgeries. We've got to get today's list finished in 5 minutes. Guys, it is not safe to have 2 surgeries done in 5 minutes, but fine, Nicole. Typically, you would go with the critical one first, but we're gonna break the rules because I think Jill will be faster to take care of. So we are here with Jill, and she has some slime. So we need to find the slime blocks that are not aligned. So I assume we're going to simply do that. Disc successfully repaired. That literally took no time. I have no idea how I did that. I literally fixed 1 disc, but we are on a time crunch. So Jack, it's your turn. Welcome to Jack's skull. Interesting. I feel like I shouldn't just be in his skull. That seems unsafe. Oh no, why do you have parkour in your skull? That makes no sense and I don't appreciate it. Nope, we're still not done. Perfect. Okay. Oh, okay. Oh, yep. There is like a hole here though, so we're just gonna give it our best shot and insta-bone. Woo! Well, that was successful because now I'm trapped. So I hope this magical stethoscope can help us. Well, you guys, I don't think today could have gone better than this. Remember, if you guys get to my videos in the first hour of them being posted, I will read them and Chuckles will feature them down below.